Medical oxygen is an essential tool for ensuring the health of patients at all levels of the healthcare system. Yet, all too often, health facilities in low-resource settings lack the infrastructure necessary to produce the oxygen patients need. The COVID-19 pandemic highlighted critical shortages in medical oxygen within low and middle-income countries around the world. As the pandemic progressed, Build Health International leveraged our experience working on global healthcare infrastructure and became a trusted global leader in providing the technical expertise needed to install, assess, repair, and maintain oxygen systems. As an architecture, engineering, and design nonprofit committed to delivering sustainable healthcare infrastructure, BHI has been installing oxygen systems in low-resource settings for nearly a decade. When the pandemic took a toll on health systems in sub-Saharan Africa and around the world that were already under-resourced, we knew that BHI was well-positioned to lend support. Starting in 2020, BHI began scaling up our unique technical expertise to work with global health partners to close the oxygen gap. We joined the Every Breath Counts coalition and many global partners to coordinate our impact with others working to increase access to medical oxygen. In the past year, Build Health International has doubled down on our efforts to repair medical oxygen infrastructure, not just to combat COVID, but to make health systems more resilient in the long run. Since the beginning of 2022, our oxygen team has completed assessments, repairs, installations, trainings, and technical advisory support in 44 countries across Africa, Asia, Europe, and Latin America. And our work is just getting started.
My name is Stephen Teo. I'm a biomedical and facilities engineer at Build Health International. When a plant breaks, my job is to identify the problem and get it back working properly. I also train technicians at each hospital I visit so that they can keep the oxygen system running on their own. In 2022, I visited PSA plants at 25 hospitals in 6 countries across sub-Saharan Africa. Every hospital has its own challenge, so I encourage the oxygen team to approach each assessment with an open mind. The technicians at hospitals we visit do everything they can to keep the plants running, but they face many challenges like unreliable electricity, lack of training, and shortage of spare parts. I'm proud that I'm able to help address these problems with BHI. Oxygen saves life, and every patient deserves access to it. There's a lot of work to be done, but I'm motivated by the work we are doing to help hospitals and treat patients.
In the year ahead, BHI is planning to increase our medical oxygen efforts even more. Led by expert engineers like Steve, our technical team is set to complete oxygen repairs and technical training in Zambia, Tanzania, Rwanda, and Guinea, and continue to advise on new PSA plant installations around the world. Through this work, our goal is to not only improve health outcomes through access to oxygen, but build technical workforce capacity and equip health systems to provide dignified, cost-effective care. Repairs are essential. BHI found that the cost of replacing a PSA plant would have been 6 times greater than what it costs to repair the same plant. We saw average cost savings of over $70,000 per plant by repairing the existing plant instead of replacing it with a new plant. These cost savings allow health systems to not only provide patients with essential oxygen therapy, but also redirect cost savings towards other critical health priorities.
One of the countries where I worked in 2020 was Malawi, where I am from. When I met with the Minister of Health in Malawi, I told him I worked at other sites, but now I'm home. This is my chance to make sure we get these things done. I'm grateful to help my home and train other technicians in Malawi to do the same.